This family is kneeling in a public square because their 5-month-old baby died after a routine heart surgery in one of China's top children's hospitals. They say the hospital is hiding the truth. The live stream was later interrupted by authorities. In the US, parents might go to the media, hire a lawyer, and start a lawsuit. In China, kneeling in public and live streaming is one of the few ways to force the system to pay attention, and even that gets shut down. So what actually happened to Baby Xu Luoxi? Baby Xu Luoxi was born a month premature, but early checkups seemed manageable. Then doctors at Ningbo University-affiliated Women and Children's Hospital found a small hole in her heart, an atrial septal defect. At first, they told her parents it might close on its own. Later, the message changed. They recommended a low-risk, minimally invasive procedure, expected to last about 3 hours. In China, big urban hospitals like this are state-run and sit at the top of a medical pyramid. Families don't really shop around like in the US. When the top hospital says surgery, saying no feels like gambling with your child's life. So they sign the consent form. 3 hours passed, then 4, then 5. For more than 7 hours, Xu Luoxi's parents waited outside the operating room. Whenever they asked what was happening, staff told them her vital signs were stable. Only later did they learn she'd suffered massive bleeding. They also say a second open chest surgery was performed without their consent. Around 10 p.m. on November 14th, the hospital finally called them in. Their 5-month-old daughter was dead. Her mother begged to see her baby, just to hold her one last time. The hospital refused, saying she was too emotional. For hours, the family was blocked from seeing their own child. When they were finally allowed in, about 8 hours later, they found Xu Luoxi's tiny body cold and alone. The family remembers what looked like a tear in the corner of her eye. In an American hospital, preventing parents from seeing their dead child for 8 hours would trigger immediate complaints, lawyers, and probably national media. In China, hospitals have far more control over the body while they handle the case, and families have far fewer tools to push back. In their grief, the parents started their own investigation. They requested medical charts, anesthesia logs, and operating room video. The hospital said there were 2 cameras in the OR. One was for real-time monitoring only and didn't record. The other pointed only at the anesthesia cart. So there is no publicly available full video of the operation, no continuous record of those 7 critical hours. Then they checked the written records. One key note said Xu Luoxi's vital signs were stable at around 10:20 p.m., but by the family's account, she had already been pronounced dead minutes earlier. Pause on that. The official record appears inconsistent with the reported timeline. In the US, this would look like the beginning of a major malpractice scandal. Records that don't match reality, missing video, and a hospital tightly controlling what the family sees. But here, the hospital is part of a state system, and the people investigating are often colleagues of the doctors involved. Because of these contradictions, the family pushed for an independent autopsy. It found a 3mm secundum atrial septal defect, a tiny hole that in more than 80% of cases closes on its own without surgery. The findings did not support the hospital's earlier, more severe diagnosis that helped justify operating. The autopsy also found blood in her chest cavity and a surgical patch left in her heart. To her parents, this no longer looked like tragic bad luck. It looked like a possibly unnecessary surgery, serious errors, and then a system closing ranks around itself. They tried everything, going back to the hospital, demanding answers, confronting security. They described being pushed and blocked. So on November 18th, they went to a public square in Ningbo. They opened a live stream, they knelt, they cried, they accused the hospital of medical errors and of dodging responsibility, hoping someone higher up would see. In China, live streams that challenge powerful institutions, banks, local governments, hospitals, are often shut down quickly. Families can't just go viral on Facebook or sit down with CNN. Even if they hire a lawyer, that lawyer is still up against a hospital backed by local government and overseen by regulators inside the same system. Their window to speak can close in minutes. As police arrived on the scene, the father's phone was taken. The live stream cut off. Parents on their knees, signal dead. That image spread across Chinese social media and ignited public anger. Under heavy public pressure, the local health commission opened an investigation. The official report cited poor risk assessment, problems during surgery, and serious communication failures with the family. Several hospital leaders were disciplined. The chief surgeon was suspended, a working group was set up, and a court accepted the family's medical malpractice lawsuit. On paper, that sounds like accountability. But in China, these commissions both oversee and protect the same hospital system. It's much closer to a hospital being allowed to largely investigate itself than to the US model, where independent experts, open courts, and aggressive discovery can drag uncomfortable facts into the light. So key questions remain. Why was surgery chosen for such a small defect that often closes on its own? Why is there no full video of the operation despite multiple cameras? How did vital signs stable end up in the records after her reported time of death? And why were her parents kept from seeing her for 8 hours? Baby Xu Luoxi's case shows how, when something goes wrong in China's medical system, families don't just face doctors and hospitals. They face bureaucracy, controlled information, and sometimes censorship. Her parents say they're not fighting for money. They're fighting so that no other family has to kneel in public just to be heard. I'm here to explain stories that rarely reach an international audience. If this story matters to you, consider sharing it. But what do I know? I'm just a panda. Make sure you're subscribed, then click here for the next one.